Hello, darlings. You've all heard of Marilyn Monroe. Some of you know Bridget Bardot. Well, now it's time for the Cognac show. I said Cognac, ooh, ooh. I said Cognac, ooh, ooh, ooh. I'm your bubbly blonde, fabulously dressed to impress.
Wellerlane, and we are here at Dr. Pober's office at his Park Avenue suite. And I'm just about to get a procedure. We'll be back in a moment, darlings, with more with Dr. Pober, board certified plastic surgeon, right here at his plastic surgery office. Big champagne kisses.
Hello, I'm Terry Thompson from Prudential Douglas Elliman. Welcome to the Hamptons. What I love about my job is that every customer is completely different, and every day is a new experience. Well, I chose Prudential Douglas Elliman mostly because of my love for Southampton. I visited 20 years ago and knew I was home. It was important to me to know that I was working with a company that had not only the technology and professionalism, but a company that would also allow me to think outside the box and be an individual.
I find her incredibly personable. I think she cares more about her job than many people I've ever met in any profession, and that makes a huge difference. There's such a sense of sincerity and happiness with the work that she does that it really is important that she makes the clients happy. And what kind of sale that materializes from that isn't as important as actually being able to do her job well and seeing people in the right sort of home.
So let me help you find your Hamptons dream. Call me, Terry Thompson, your key to the Hamptons.
Welcome back, darlings. I'm here with Daphne, and she's going to apply. This is a topical treatment that you're going to apply on me so that I do not feel the pain before doctor does the procedure. Am I correct?
Yeah, this is an anesthetic, and basically what it does, it numbs out the area where he's going to be injecting you, and then that way you'll have a block for the pain.
Fabulous.
Put that on you. It's going to feel cool.
Injecting. It's one of the newer products, and what I like about it is that at 6 months after Radiance is injected, it starts getting replaced by collagen. So even though the manufacturers only mention a 1 year to 1.5 year duration for its maximal benefit, what I found that over time it mellows. And probably one of the reasons that it does mellow so slowly is that it gets replaced by collagen. And that makes it a biologically beneficial product beyond just volume enhancement. It also allows our own body, the fibroblasts, to generate new collagen and elastin. So that becomes a wonderful addition to it. So I think it's almost a double benefit of making you look better and making you healthier. So it's a nice sort of addition to the armamentarium that doctors have as plastic surgeons when they're doing facial enhancements. And you'll see the benefit immediately, which is a really big
That's
change.
amazing. Now, you're doing 2 procedures today. Explain to my audience what you're going to be doing.
Exactly. We're doing 2 procedures. What I use Radiance for is for volume enhancement. And I inject Radiance at a very deep level or at a subdermal level and above where the bone is. And that allows me to increase your cheekbones a little bit, and by doing that I pull away the tissues that create that nasolabial crease. After I do that, we'll see how much you need in your nasolabial creases, and rather than inject something like Radiance, which is a little more durable and heavy, I'll inject a very fine product which will remove that little etched-in line you have. It's called Restylane. And for your lips have a nice shape, and what we're going to do is enhance that shape. We're going to highlight it, and we're going to highlight it with Restylane by just doing your white roll, the border of your lip. That'll give it a nice enhancement. It'll just reshape the Cupid's bow a little bit and reshape the borders of your lips. And not volumize too much, but just simply shape what you have and give it definition, increase the definition of it all.
Amazing. Now, tell my audience about the recovery time with this.
Well, that's one of the beautiful parts about it. The recovery time is essentially non-existent because you, in most cases, look very, very good right afterwards. With the Radiance, there's no question because we're injecting deep. Occasionally with the Restylane, since we're injecting so superficially, you might have a little bit of what we call ecchymosis or black and blue areas. And perhaps a little swelling that's a little apparent from that. But it generally subsides as quickly as any black and blue mark might. So it works out very, very quickly. Most of my patients have very little.
No black and blue.
No bruising.
I'm hoping that that's not going to be my case because I'm going to be on the red carpet in another hour.
Well, the other advantage of this is if people have mishaps all the time, especially when you're on a situation like this, if it happens, makeup is your friend. You can apply it. It'll cover it
I
up.
already have some makeup on.
Okay, so that helps. That helps.
Well, I'm very, very excited about this procedure, and I know that Dr. Pober he really is a tremendous plastic surgeon, and he's a Harvard graduate. I mean, you can't get any better than that. And I trust my face with Dr. Pober.
Thank you very much. We're going to get started in a minute. I'm going to have you come inside the treatment room.
Dr. Pober, now let me ask you something. This numb feeling that I'm feeling right now, how long is that numb feeling going to last?
A very short time, because that's a topical. And the topical's maybe a half hour to an hour, not that much longer. The entire process of the treatment will only last for a few minutes, so I think we're protected for the time period that we're doing the procedure for.
So the procedure is literally minutes.
Exactly minutes. And the beauty of this procedure is I'm going to have you have a mirror in your hand, and while I'm doing it, you'll be able to see exactly how far I'm going with it, and you can decide, do we want more, do we want less? And that's a nice way of cooperating with your care. Okay, let me have the marking pen for a second. Let's just mark everything out first. We're going to rehearse again what we talked about. What I was going to do here is just lift this up a little bit, and I'm trying to find where she'd have the maximum benefit. And it turns out to be right here. Right there, and I think that's going to help in a nice way. And then what we're going to do is enhance this a little bit with a few strokes in this direction here. What Cognac has are very beautiful high cheekbones, and we're not going to take away from there, but she has a little bit of a submalar hollow on this side. And it's important to realize that there is asymmetry to even very pretty faces. And we're going to focus on doing a little bit of an enhancement right here, and we're going to be very subtle. And now when we look at the other side, I like the transition point here more, so we're going to be very, very minimal here. Do a little bit right about here, and I think we need a little less. And if you notice, it's pretty much in the same proportion, same location where this dot is. And because we'd like to have symmetry at the end, and it's going to be a nice modification in just that. Then we're going to focus on some of these etched in lines here, and we're going to focus with using Restylane. You'll probably wonder, do we have makeup here? And the truth is we do.
The makeup, will it?
It will bother you. That's why I'm wiping it away right now. I'm using this to remove the makeup and at the same time sterilize the area. Right. So we're doing both at the same time. So notice I'm not taking everything away, just where I need to have it done. And that kind of takes care of it. There seems to be a residual little mark there exactly where I want to inject it, but that's imprinted in the skin, and those are the kind of things you want to notice before you do it. Everyone has a little bit of skin irregularity, but that gives us an idea of where we're going. That mark was there to begin with, so we're going to use that as a little focus of where we're going. I go straight down to bone. I hit bone, and then I inject just a little bit. To that area. You can see how that automatically gave us a bit of a lift. Exactly. That was an acne scar. Exactly right. And I point those things out because what I'm doing is really below the tissue skin, and sometimes people think that we change things on top of the skin, and we're not doing that. We're just changing below the skin. Now, this other injection is going to give us a little bit more of a volumetric lift.
It's almost like you're sculpting the face.
Exactly. It's exactly what we're doing. Sculpting the face. And that gave us a nice little volumetric change. I'm just mold it now a little bit. Mold it, and I'm molding it with heat of my finger more so than with the pressure. just to give it a nice sort of overall change. And let's give Cognac the mirror for a second. I want her to see the change. And all we did was make that side look a little more fuller. We can give it a dramatic change. She had very nice high cheekbones. Now she looks just a little less hollow here. And I think we've achieved the look that we're looking for. And what motion of her face causes that line to become more and more apparent. Move your face just a little bit. Every motion, it's a relatively dynamic line. And unfortunately, we shy away from using Botox in this area because we don't want to alter someone's smile. So we're really at a bit of a handicap. We're going to be injecting Restylane into this area. As I mentioned, Restylane is a little different from Radiance in that it's a different product altogether. It's hyaluronic acid, and it's injected into the dermis. And because it's in the dermis, you can see some of it can come out because you can see she had acne scarring. With the acne scarring, your pores are a little enlarged. Your pores become a little bit more amenable to escape of the Restylane. So we have to be a little careful when we put this in and try to get not too deep, but just deep enough to get the change without the extrusion. It'll only look better with time. What I like to do here,
That's really nice.
it's going to look better with time because it starts absorbing water and it starts looking better. Let me have a little Vaseline, please. Now we're going to go ahead. We're looking at her Cupid's bow. She's got a very pretty Cupid's bow. We don't want to lose that. We're going to enhance it, and we're going to just, I like the lips to taper off, and we discussed this a little bit, so we're going to allow the tapering of the lip to continue. What we're going to do is enhance the white roll. And I do that through a serial injection technique. I reach the border. And automatically, Cognac, I'd like to take a mirror and take a look at that.
Now, what is this, collagen?
This is hyaluronic acid. It's the same component that forms the ground substance of every cell of your body. Just take a look at the left side of your lip now. It looks like you're wearing makeup of a special kind. Can you catch that? And your lip looks just a little bit more defined than before. And it's a pretty definition. We didn't exaggerate the look of it. We just made it look subtly a little more defined right at the border of it. Now we'll do the same thing on the opposite side.
Dr. Pober, board-certified plastic surgeon, and we just finished this fabulous procedure. It's a little bit hard for me to talk, obviously, because I just have this wonderful treatment, this aesthetic that you performed right here in your office. Are we all done?
We're all done for now, absolutely. And one thing one has to realize about this is it's not all done forever. It's all done for the moment, and this is a maintenance program. Whenever you feel like having a little line less noticeable, you come back, we do a little more Restylane. You want higher cheekbones, you come back, you do a little more Radiance. The beauty of the procedure is that right now you're ready to go back on your show or go out and have a good time.
I'm ready to go on the red carpet and do some interviews. Isn't that amazing? We're going to a cover launch in a few minutes, and Dr. Pober, board-certified plastic surgeon, has performed this wonderful procedure. As you can see, the lips, the lines. I'm not wearing any makeup. You've never seen me like this before, but what the hell? Anyway, I can't smile for 4 hours. But anyway, thank you so much, Dr. Pober. Tell my audience the website. Where can we go to find out more information?
They can find me on drjosephpober.com. And they can certainly see me in my office. I'm at 975 Park Avenue, right here in New York City on 83rd Street. And we do a lot of these procedures here every single day. And it's a wonderful thing for most people. This is a way of life for many in terms of maintaining their look day to day, month to month, or year to year. And
I have to get you in the Hamptons, darling. Give me a kiss.
My pleasure. You can't kiss it too hard. You got to leave things soft.
We'll be back in a moment, darling. So more interviews right Park Avenue Top's plastic surgeon, Dr. Pober. We'll be back in a moment with more interviews. Keep watching. Pink Champagne Kisses.
Fabulously dressed to impress. One of a kind girl. This has been a Crybaby Productions, darlings.